What if one of the fastest growing health threats in America isn't a virus at all, but a fungus that's becoming harder and harder to treat? That's exactly why health officials are sounding the alarm over Candida auris, a drug-resistant fungus that's spreading through healthcare facilities across the United States. While experts say there's no reason for the general public to panic, the latest numbers show this dangerous organism is continuing to expand, raising new concerns for hospitals, nursing homes, and the patients who depend on them. According to the latest CDC data, more than 3,000 cases have already been reported in 23 states this year. Texas currently leads the nation with more than 700 reported cases, followed by Michigan and Illinois. Even more concerning is the long-term trend. Annual infections have climbed dramatically over the past few years, showing that this isn't an isolated outbreak but an ongoing public health challenge. Health officials say the increase reflects both wider spread and improved detection, but either way, it's a trend they're watching very closely. So, what exactly is Candida auris? It's a type of yeast that can enter the bloodstream and cause serious infections, especially in people who are already dealing with major health problems. Unlike many common fungal infections, this one has developed resistance to several medications that doctors normally rely on. In some rare cases, certain strains have even become resistant to every major class of antifungal drugs, making treatment extremely difficult. That's one reason infectious disease experts describe it as one of the most challenging pathogens currently affecting healthcare settings. But here's what many people misunderstand. This fungus is not spreading through everyday community contact like the flu or COVID-19. Instead, it primarily affects hospitals, long-term care centers, and nursing homes, where patients often have weakened immune systems, breathing tubes, lines, or other medical devices. Those conditions create opportunities for the fungus to enter the body and spread. Healthy people rarely become seriously ill from Candida auris, and experts continue to emphasize that the overall risk to the public remains very low. One reason this fungus has become such a concern is its ability to survive on surfaces for extended periods. Medical equipment, bed rails, furniture, and other frequently touched areas can all become contaminated if strict cleaning procedures aren't followed. That means healthcare workers must rely on rigorous infection control practices, including gowns, gloves, patient isolation, and specialized disinfectants, to keep the organism from spreading to other vulnerable patients. It's a reminder that preventing infections often depends just as much on hospital procedures as it does on medical treatments. The story of Candida auris is relatively recent. It was first identified in Japan in 2009 and wasn't reported in the United States until 2016. Since then, health agencies have worked to track its spread while researchers race to better understand why it's become so resistant to treatment. Scientists continue studying new diagnostic tools and potential therapies, but preventing transmission remains one of the most effective strategies available today. Doctors say people with diabetes, blood cancers, weakened immune systems, or those who spend long periods in hospitals or nursing facilities face the greatest risk. Symptoms can include fever and chills, but because those signs are common to many illnesses, diagnosis often requires specialized laboratory testing. That's why experts encourage healthcare facilities to identify cases quickly and isolate infected patients before the fungus has a chance to spread further. For families with loved ones in hospitals or long-term care facilities, the advice from experts is straightforward. Practice good hand hygiene every time you visit. Follow any infection control instructions provided by healthcare staff, and don't ignore posted precautions outside patient rooms. These simple measures may seem small, but they play an important role in protecting patients who are already medically vulnerable. At the same time, infectious disease specialists stress that people outside healthcare settings should not panic, because the fungus is not circulating widely in the general community. As researchers continue monitoring this emerging health threat, the focus remains on early detection, careful infection control, and continued investment in medical research. The growing number of cases serves as an important reminder that drug-resistant infections remain one of the biggest challenges facing modern medicine. While most Americans are unlikely to encounter Candida auris in everyday life, hospitals and healthcare providers are being urged to stay vigilant as they work to protect their most vulnerable patients. If you found this update helpful, don't forget to like the video, and turn on notifications so you never miss the latest news. Thanks for watching.